National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopathic Doctor Jonathan Beatty here, health expert with Nationalnutrition.ca. Do you or someone you know suffer from high blood pressure? Well, this condition we know medically is hypertension, and if you do, please stay tuned because we're going to cover some things you can do to help get your high blood pressure under control. So, how do you know if you've got high blood pressure in the first place? Easiest way, head down to your doctor, get them to get the blood pressure cuff or the sphygmomanometer on you, and that can be used to test your blood pressure. If it's high, if it's typically above 135/90, your doctor is going to diagnose you as being hypertensive, and ideally, if it's only mild hypertension, they're going to give you the opportunity to get your blood pressure under control naturally. If it's a little bit higher than that, they may want to use a drug to control your high blood pressure. And the reason behind this is that elevations in blood pressure are associated with an increased risk of having a heart attack or stroke, and so they're going to try and control your blood pressure artificially using pharmaceutical to reduce your risk. Now, that being said, the high blood pressure in the first place is not a lack of this drug in your diet. So I'm not against using an antihypertensive drug. They're there to preserve life. They're there to sort of buy you time to get healthier. That's the original intention of those medications. So like I said, I'm not against the medication, although if you do get that diagnosis of high blood pressure, that's the time for you to get motivated to get your cardiovascular health back in order so that you can one day hopefully wean off of that medication. And the easiest ways to get blood pressure back under control is diet, exercise, and stress management. These are the 3 things that I constantly preach to my patients that they need to control to reduce not just their heart disease risk, but pretty much their global disease risk. So symptoms of high blood pressure, often high blood pressure is asymptomatic, which means it very rarely has symptoms. When it does become severe hypertension, sometimes you can get redness of the eyes, you can feel irritable, you can actually get headaches from it, or you sometimes just feel kind of like pressure in the head. And those are typically the only symptoms, if any, when you do have high blood pressure. So therefore, it is better to just get regularly scheduled checkups and have your doctor test it regularly to ensure that it's not slowly developing in the background. Because again, mild hypertension or mild elevations in blood pressure rarely show up with symptoms. So if you do have it, some of the dietary changes you're going to want to make to manage your high blood pressure, increasing your fruit and vegetable intake. This one is so important. Fruits and vegetables provide the nutrients that your body needs to properly manage oxygen levels. You see, one of the main reasons your blood pressure goes up in the first place is your body is trying to transport more oxygen to a tissue or more nutrition in your blood to a tissue. Somewhere a tissue in your body is starving. And so by increasing nutrient density of your food, making sure that your blood is capable of properly carrying oxygen, a diet high in vegetables is very alkalizing, helping again your body to carry more oxygen. When your blood is acidic, it can actually carry 20 times less oxygen than when your blood is mildly alkaline. So that trend towards alkalinity is very important for helping to reduce hypertension. Other things that can cause hypertension are hardening of the arteries. So again, reducing atherosclerosis by eating a diet high in fruits and vegetables is very, very effective. Exercise. Practice makes perfect. The more you exercise your cardiovascular system, the more efficient it gets at transporting oxygen. When you exercise, you increase oxygen demand on the body, and so what the body does is it compensates for this and it becomes more effective at transporting oxygen in time. The more effective it is at transporting oxygen, the more stable your blood pressure will become. And then of course, other things to look at, reducing caffeine intake. Caffeine can be very stimulating, and it in and of itself can cause high blood pressure as well as stress. So when we get stressed, one of the natural things that our stress response does is it actually releases a ton of chemicals that tighten up our arteries. That's so that our body can, aggressively pump blood to organs in need, because classically it's a survival mechanism. It wants to make sure that you're going to have adequate blood pressure to pump a lot of blood to working muscle so that you can either fight or flight. You know, it's a survival technique that our body has adapted. However, when we're under a lot of emotional stress, it's inappropriate, and so our body will have this chronically elevated blood pressure even though there's no extra energy demand on the body, and that creates problems, and that can actually lead to a heart attack. So again, that's why you want to do things like deep breathing techniques. Just as when you get stressed, your breathing changes, changing your breathing can actually change your stress levels. So doing deep breathing techniques, if you're not sure how, there's a lot of great videos online about that, as well as, you know, maybe consider doing a yoga course where one of the tenets of yoga is focusing on proper breathing techniques. So if you do suffer hypertension, I hope this video has helped you. Check out more of our videos on our channel, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.